A beautiful morning to everyone. I'm Joanne Fangonilo, staff nurse at La Union Medical Center. I proudly present my study entitled A Nightingale's Vision, the Live Experiences of Nurses During COVID-19 Pandemic. During the unprecedented arrival of COVID-19, nurses around the world are on the front lines battling COVID-19 daily, and their presence is the outstanding defense against the spread and control of this disease. This pandemic is bringing jarring stress on healthcare workers as they are called upon to make difficult care decisions and work under limited resources of constraints. Besides, nurses have to accommodate new protocols to adapt to a so-called new normal. This research intends to uncover the perceptions of nurses based on their experiences during the COVID-19 pandemic. For the research design, this study utilized the qualitative interpretive method of phenomenology that seeks to understand the meaning of being in the world. Specifically, Heideggerian hermeneutic phenomenology is employed to provide understanding through meaning by permitting these texts to speak for themselves. The researcher investigated commonalities from the participants' interviews. The participants of this study were 10 nurses working at either government or private hospital in the province of La Union, of any job status, age, sex, on duty during the start of COVID-19 pandemic, and at least 1 year in service. Moreover, data were collected using the proposed full sampling method. For data gathering tools and procedures, in phenomenology, the researcher is the main data collection instrument, conducted through the face-to-face interviews and through Zoom meeting to explore the participants' experiences. The research was examined by the Ethics Review Board, chaired by the Dean of Graduate Studies and experts in the field. The informed consent patterned from that of World Health Organizations was provided to the participants. There are precautionary measures observed in the conduct of interviews for the safety of both the researcher and the participants. For the ethical considerations, the researcher observed the principles of beneficence, autonomy, and justice. The researcher ensured confidentiality in all data gathering. For the data management, interpretive phenomenological data management was used to gather a detailed and complete description of the lived experiences of those participating in the study. The researchers' interpretation was the fore in the data analysis process. Heideggerian hermeneutic phenomenology was used as the research approach to this qualitative study. For the transcript, digest, and level of analysis, Van Manen suggests that the researcher must acknowledge his or her previous experience, knowledge, and beliefs, and how this may influence the researcher in all phases of data collection, analysis, and interpretation. For establishing trustworthiness of data, the rigor of this study was demonstrated by credibility, transferability, and dependability. For the results and discussions, Nightingale's message had moved the world to see the vision of nursing she had founded and contributed incongruent to today's practice. Based on the findings of the interviews, experiences of nurses unfolded into these themes. First, the challenges and fears during COVID-19 pandemic. Second, their coping mechanism, motivations, inspirations, and desires in doing their job as a frontliner. Organizational responsiveness and collegiality. And third, the realization during the COVID-19 pandemic. The silent ambush of COVID-19 virus alarmed the public to reveal that nurses in the front line were a Nightingale's vision, that to play a vital part in reshaping the future of the nursing profession and fighting for a healthcare system steered by the needs of patients. This study focused on the three main themes. The first theme was Once in Constantinople. It pertains to the participants' challenges and fears. In line with the current happenings, once in Constantinople referred to the new twist of challenges concerning in the real field that nurses face today, specifically in delivering quality care and safety to their patient. Hence, they help us examine the situation to improve the response and preparedness in a pandemic. In this study, the following were the challenges and fears of nurses encountered in their duties during the surge of pandemic occurrence and influence. First is the challenges related to pandemic protocols. Second, challenges associated with the influx of patients, long working hours, and work shift. Third, challenges connected to the discrimination and facing stigma, dilemma. And lastly, fears linked to being infected and psychological fear. In summary, these challenges and fears were the right amounts of stimulation for the government and the leaders toward reforms on the healthcare system to enhance our ability to cope and serve the patient with their basic needs in response to the crisis like the COVID-19 pandemic. The second theme was the lump. At time of pandemic, the lump had approached its light towards the present to connect with the nurses towards caring and healing to the sick that benefited patients and saved countless lives. Thus, light still shines in the darkest days of healthcare. In this study, the following symbolizes the lump. First, coping mechanism of participants. Second, motivations and inspiration of nurses. Third, desires of participants, organizational responsiveness, and collegiality. Nurses gained valuable learning, information, knowledge, and practice dealing effectively with many burdens of the public health crisis. However, they needed additional education and training about COVID-19 issues and risks specific to their practice area. The third theme was Valiant White Patriot. It pertains to the participants' realization. During this ongoing pandemic, participants were at the heart of what they perform every day to support healthcare and defend and save their patients from the virus. This was a significant transition in the nurse's life to witness the power of nursing. Therefore, nursing was a gift to humanity, and nurses were called by God to serve the people. Nurses were the living prints stimulated through the vision of Nightingale. They were the master of nursing and the only one who could comprehend and value the magnitude of their work. For the conclusions and recommendations, this study findings indicate that nurses are the pillars of hope to humanity and the valor of healthcare during the COVID-19 pandemic. But nurses are not robots. They get exhausted too and need a temporary timeout. In reality, nurses are working in deficient and unprepared healthcare conditions with many challenges they encounter that may lead to and leave the nursing workforce traumatic. Their fears during the unprecedented arrival of COVID-19 are conquered by motivation and inspiration from their family, leaders, and support group. They have experienced the most heartless invaders to humanity, and they desire to improvement in response to pandemic. Finally, the nurses showed a new image of the nursing to the world, indeed a Nightingale's vision. Furthermore, the study recommends a multifaceted engagement between local government units, healthcare organizations, and nursing groups to recognize the role of the nursing profession in pandemic control. Nurses should continuously receive training on infection prevention control to follow advised safety precaution measures. Adequate staffing is essential to ensure that nurses can take breaks during shifts, take leave when they are ill, and provide an appropriate skill mix. There is a need for support system among nurses to provide mental health and counseling resources to reduce stress and anxiety. Moreover, supportive interventions for nurses, including positive attitudes in the workplace, recognition of their efforts, concise communication, instruction, and support from supervisors and management are necessary to boost their morale. The findings from this study can be used for further research in this field and serve as an evidence approach for immediate response to future health emergencies and enhance nurses and status and the healthcare system in the Philippines. Let us never consider ourselves finished nurses. We must be learning all of our lives. By Florence Nightingale. Thank you and God bless us all.